Today we're going to talk about the My Medic MyFac Pack. It is chock full of good stuff. The nice thing about this, it wasn't made for military, it wasn't made for police, it was made for regular people. And you can tell by what they've put into it that it's made for regular people because this is not, there's some good things and there's some bad things in here. Overall, I like it. I think it's worth the buy for the average person. This is not a kit that you can obviously attach to any kind of kit. This is actually something you're probably leaving your vehicle, or for a small church, you're going to leave this somewhere in the lobby so you can grab it in case of an emergency. The price point is right. It costs a bit of money, but for what you're getting out of it, the price point is probably some of the best that I've seen before, which is why I'm bringing it forward right now, because I think this is within reach of a lot of churches and a lot of people that don't have a ton of money. We're going to talk about the ups and downs. We're going to talk about what's good about this, what's bad. I am going to talk about some of the things that I'm going to replace in here, but if you don't have a massive amount of knowledge, this is actually really good to go right out of the box. Let's talk about it. First things first, let's talk about this hefty case. Now, when I first saw it, I thought it was a little big, but it's actually grown on me. You've got this strap that'll keep everything together. You've got some nice MOLLE on the outside that you can connect other things. This little Medic little clip-on thing right here, this just clips on. I can pull this off so I can put other things on here. What I might put on the outside is a tourniquet holder that has a tourniquet on it right now that I can just grab it and put on somebody or throw it to somebody so they can put it on themselves. So I do like that, and it's the modern MOLLE where it's pretty easy to deal with. All right, so on the back, we've got this back panel, and it's just Velcroed on. You can peel that off and you can get rid of this. This is also MOLLE, but like it comes with these MOLLE straps. You might put this like on your vehicle. Some of you have like MOLLE panels in your vehicle, and that might be what that's good for. But also it's got Velcro on the back, and some of you on those same panels just have Velcro. I think I might just Velcro that on there so I can peel it off and run with it. What I do like is I like this little waistband thing, so I can actually wear it as a waistband around my waist. I can throw it around my shoulder. I can stretch it way out so I can like cross shoulder it and still shoot or do whatever I need to do. I kind of dig it. I'm not going to lie. I like it. So let's open it up, see what's inside. It's got these two big zippers that are very hefty. It seems like it'd be very hard to break these. The zipper is not something that's going to get caught up on anything. But when you open it up, there is a lot of stuff in here. You've got a panel with some kind of major trauma stuff over here. You've got some chest seals and some other things here. You got little boo-boo stuff over here. And then we'll get into this as more burns, splints, and some other stuff. It literally has everything. So at some other point, I am going to show you what's in my individual first aid kit, my IFAK, that I built myself. This is not going to be something on your battle belt. Okay, this is going to go in your car or in the church. I do like it. You can treat a person, maybe two. If you get one person that's all shot up, stabbed up, something like that, you're going to run out of stuff really fast. I am going to talk about some of the packaging in here too. There is some stuff I would change, but I see why they're doing it, so I'm just being very critical. Let's start over here with some of the things that you're going to get. First things first, one of the most important things is trauma shears. Trauma shears are awesome. You can actually, if you wanted to, leave this on the MOLLE on the outside and push it down so that it's like just ready to go like that. I think that's what I might end up doing with it, so I can just grab it and start shearing while another person grabs the pack, because when somebody gets shot, you want to start cutting off clothes and getting things out of your way so that you can start treating them and finding other things that might be wrong with them. You've got some 550 cord. 550 cord is always nice to have. It's just a little something extra that's in there. It's not like you may not treat the person, but you might use this for, I don't know, anything. Realistically, it's one of the best things you could have for just using anything. Got a little finger splint on here with some tape that goes inside. And you'll notice that everything has this packaging on it. This packaging. I like it and I don't like it. I like it because it keeps everything nice and neat and together. I don't like it and then some things, like let's say the chest seals, which we're going to get to in a minute. If I've got blood all over my hands, or I've got gloves on that has blood all over my hands, I think this might be hard to break open. especially when you're under stress. So I think what I might do is I might do a side by side, and I might put simulated blood on my hands and then try to rip it open and see if it's a big deal. I don't know if it is or not. I haven't tried it yet. It's just something that popped into my head when I was looking at it. But for the splints and stuff, I think this is a good idea. You're just gonna tear it open, and then you can open it up, and you've got like a little tiny splint for a finger or something, and then the tape to go with it, right? Everything's taped up. I think a splint's not as important to have unpacked, but I think what I would end up doing personally, I'll take this out of the packaging and then put it back in here, because I'm not really worried about this being sanitary. I really don't care. This is temporary for me to go to the doctor, right? And it's not life-threatening stuff. I am a proponent of really unpackaging a lot of stuff and having it out ready to go so you can grab it and use it when it's an emergency, because during an emergency, no matter how trained you are going to be stressed out, and trying to get some of these packaging open is going to be really tough. So the more you can have open, the better off you are. I mean, there's stuff in here like a cold pack. I normally wouldn't have this in a bag. It's not a bad thing. I mean, you get somebody with a bee sting, you get a somebody with a boo-boo, like like my granddaughter the other day bumped her head, had a big bump on her head. Break it open, put it on their head, it'd be fine. It's just something nice to have. They also have an elastic bandage. I would really take this out of the packaging, to be honest. They have packaging on everything. I just like pre-staging it to have it ready. This isn't really something that's going to go inside of somebody, or it's just nice that if kind of have this elastic bandage to kind of put extra pressure on something to keep a bandage in place. It might be slipping around. It's a temporary thing. I don't have to worry about it being too sanitary, right? So I just leave the packaging out of it. A little mini wound closure kit, and basically it's just skin glue, right? It's super glue. Super glue works perfect for wounds, and it's got wound closure strips that you can put over that as well. This is something that works very good. I like it a lot. It's not something I would normally have, so it's kind of got everything here. And then here you got a 2-pack of Z-Zips. These are, you can see on the packaging right there that it's something that you're going to use to close up a wound. I like these, really good. There's a lot of, this is a great truck or church first aid kit. Now in here, you got assorted tools and first aid. Now inside, we'll open it up, but inside you've got your whistle, you got a pin light, a pair of tweezers, a thermometer, and 5 thermometer sheets. So you can use this on 5 separate people if you wanted to. Again, you can open this up and keep it in this package here, but open it up and kind of pre-stage everything, because everything has packaging on it. Last, for this side, you've got a triangular bandage. These things are awesome. It could be a headband. When I was in the Army, we would steal these out of the, I wouldn't say steal, we would acquire them out of the vehicle's first aid kit because they were olive drab, and we would use them to keep dust out of our faces. Whereas a kerchief put up around our face to keep, because where we were stationed at was super dusty. Use it as a headband, use it as an arm sling. It's like, it's very diverse, very awesome. And then last but not least, we've got our adhesive tape that we can use to tape up all sorts of wounds and bandages. It is just awesome. Okay, coming to this side over here, you have your chest seal. Now, it's an airway chest seal so that if somebody had tension pneumothorax, a hemopneumothorax, some of you like layman's terms, a collapsed lung, not really kind of totally appropriate way of saying it, but you get what I'm saying. When you got the hole right here, you can put this over it. It's not the best chest seal, but it's a good enough chest seal for you to use until paramedics get there, or you get the person to a hospital. It seems like My Medic is making their own stuff and then packaging it up, and that's how they're keeping the costs down. And I got to give them credit. It's not the best stuff, but it's still really good for something you may or may not use. It's nice to have on hand and to have it available to you at a very decent price that's affordable for most people and for most churches. So you've got your chest seal over here. When I pre-stage chest seals, I do want to kind of keep them somewhat clean. I do know people that pre-stage them by ripping them out of the packaging and then putting them back in. I know other people keep them in the packaging. So I think that one's really user preference. Next up, we have nasal pharyngeal airways. I would pre-stage this. Essentially what this is when you look at basic trauma, when we look at TCCC, Tactical Combat Casualty Care, one of the first things you're going to do is grease this baby up and stick it up somebody's nose to help keep their airway open. I've used these before in a tactical environment. They work great. I like them. It's amazing how much it'll open somebody's airway. Great tool. I do have these in my IFAK, and again, it's right here for you as well. They give you, actually, there's a second set. So you got 2 sets of these, which is absolutely awesome. I dig that. Good call for them. Then you got a little hydration module. And it also has, so it's got 2 hydration packets along with water purification tablets. So you got a heat injury, somebody needs water. You've got everything you need to give them some electrolytes along with some water purification so that they don't get sick. Very good. Not something I normally have in my IFAK kit, but this is actually kind of growing on me. I really like this kit. Now here's your first, your CPR mask. I would open this up and I would pre-stage this. Now this is just a barrier that you're going to put into the person's mouth and then you're going to blow on the other end. These are okay. A lot of people that you're giving CPR to, if you're doing it wrong, they're going to vomit. OD patients, after you give them Narcan, they might start vomiting. I personally don't like giving breaths to OD patients. Number one, most CPR is not teaching to give breaths anymore because most people were getting it wrong. People that OD though, I'll talk about it in my fentanyl class that I'm putting together now. They have a lot of diseases. I am suffering from a disease right now that I got from somebody that was a heroin addict. I'm very wary about putting my face down there with them. So I'll give them compressions. I'll give them Narcan. I don't think I want to put my face down there too much. So just something to think about. If it's a loved one, I don't need a shield. We're just going to go do what we need to do. Either way, I would pre-stage this because when you're under stress, it is going to be very difficult to grab onto that. Comes with nice little CPR directions. They are not going to live if you got to read this first and then figure out what to do. So I'm going to take this and just throw it away because I don't need it and it's just in the way. So that's it for this module. Let's go ahead and move to the back. Let's flip this over. And on this side, you got your eye wash. I might keep it because eye wash I won't need to get in an emergency, and I do want to keep this from leaking. So I'll probably keep that together. You got a nice treatment and relief mod right here. You've got triple antibiotics. You've got lip balm, sunscreen, sting relief, white petroleum, hydrocortisone for itch relief, right? Oral pain relief, ammonia towelette, you know, to wake somebody up, smelling salts basically. And then chafing cream. Not a lot of stuff I'd probably use in here. I do like this. I actually might pull this out and put it in my travel bag to take with me because it's got a lot of good stuff in there. And then here, this is a really good one to have. This is your clean and prep module. For topical, it's got 4 antiseptic wipes, 4 hand sanitizers, and an iodine prep pad. That's the one to keep you clean. You got some blister strips, the space blanket. I kind of dig the icon they put on there. I think that's kind of neat, little spaceman with a first aid emblem. Space blanket, because a lot of the time you're going to have like a gunshot wound victim who has lost a lot of blood. They're going to start getting cold and you're going to want to keep them warm. And so it's good to put the space blanket around them. It's just something that will help for those trauma patients to keep them warm so that when they lose body heat. We've got our nightstick. I would keep this sealed up. Nightsticks are awesome. I kept one on me all the time, even on patrol. As an example, like on patrol, what I would do if we had a hot call, like a shooting, and you know, all the cops parked down the street, walked their way up. Well, the hard part for cops is finding the address. So if I'm the first one there and it's nighttime, I'd break this open, throw it in the middle of the street. When you turn the corner, everybody would see it and they know exactly where the house is. This is good for like if you have an issue where you have to have some kind of light discipline and you're in a room like this and it's pitch black, you break it, leave it open, and it helps it so you can treat the people. It's just all around good tool to have. I do keep that on my battle kit. You got your medication module. You got your ibuprofen for a pain reliever. You've got a fever reducer. You've got 2 aspirin for pain relief. You got some diarrhea and nausea medication in there. You got Dramamine for motion sickness, diphenhydramine for your allergy relief. You got more anti-diarrhea stuff, and then some cold and flu meds. Again, this is a good one for travel. I like that a lot. So that ends this section. We're going to move to the last section, and we've got some good stuff over here to talk about. We're going to get in deep on talking on some of this stuff. All right, moving on to our last section over here. My biggest beef with the MyFAK kit is the tourniquet. This is the rat's tourniquet. I kind of got an issue with it because it's not that good. And they're manufacturing their own stuff, which brings down the price. But literally, I'm not going to use this, and I'm going to put in a cat's tourniquet. Let's open this up. This is something I would pre-stage because if you need a tourniquet, you don't have time to do what I'm doing here. So the rat's tourniquet. Ugh. So I haven't used this in a true trauma environment. I've never used this on somebody before. The big thing is, look at the width. So look at the width on this, and look at the width. Don't look too closely. This is a training tourniquet, but look at the width of these two together. So if you put this on a patient that's bleeding out and you have to put this on them, this is going to hurt. And they are going to try to take this off. And that's the last thing you need, because if they take it off, they're going to bleed to death. This is way too thin to put on somebody. It is going to be painful. In fact, I'm not even going to put this on anybody because I would like... And feel how elasticy it is too, right? I just think it's not going to work well. I think it's going to hurt the patient. The patient's going to want to take it off. I will keep this as a demonstration so we can use it in classes, but I am not. The cat's tourniquet I like much better. It's much wider. It's kind of the gold standard. This is my training one. You can see there's some fake blood on it. Plus it's not true length because we've cut it. But look, it's much wider. And so the patient, they'll still want to take it off, but not as much as this one. And there's only one in here. I personally put 4 tourniquets inside my first aid kits like this. Why do I put 4 in there? Because you got 4 limbs, or you can treat multiple people. You just have more to work with. And I think this is kind of the most important tool in the entire MyFAK kit. So this is going to get thrown away. Maybe we'll use it for training. It's going to get replaced with a really good tourniquet. Still a great pack. Really my biggest beef with it. They also have their own branded gauze and pressure dressing. So this is their emergency pressure dressing. I always open these up and pre-stage them. How can I put this? A lot of people are worried about infection later down the road, and you should be, okay? But the person got shot by a high point 9mm loaded by some dude that has had that bullet buried at the bottom of a toolbox for the last 30 years. And it's picked up so much grime, and that's now sitting in his gut. And now you're going to put the pressure dressing on. So it picked up a little bit of whatever in my IFAK right here. That's not as bad as the bullet that's in him and that's eating away and starting to cause infection in there. I'm worried that when you have blood on your hands and all those, this one's actually in there really tight. Oh, here you go. You got a little split right here. So I'm going to put some simulated blood on my hands. I'm going to try to open this and see like how easy it is to open it, to see if it's difficult or not, to see if it's a big deal. Because if you've got blood all over your hands and you're trying to put this on and control stuff, this is going to be stressful. I would pre-stage this. I'll open it up, see what it looks like. It looks like it would do the job until paramedics got there. And again, your little gauze pad right there. You got some compressed gauze. This is not for wound packing. This is just for just small gauze to kind of fill up a space and soak up blood. They do have quick clot. I might replace this quick clot is pretty good. It seems small. I might replace this. So I think you might run out when you do wound packing, which we did a great wound packing class, and I am going to do a wound packing video coming up. This quick clot seems really small. I think I'll get the law enforcement or the military version, so it's a little bit bigger. Because what I'm afraid of is if I got to pack a wound, I won't have enough. And I'll probably put 2, 3, or 4 of these in there. And then don't forget they expire. This one does expire March of 27th of this year. So they shipped me one that, or is that the manufacturer date? That might be the manufacturer date. Oh, here we go. Sorry, my bad. The expiration is June 27th to 29. So I got 5 years. So another 5 years, I'll go replace this. So still pretty good for your average person. I think that's really good. You got nitrile gloves. You got 2 pairs. I would rip these out of here and keep them open and shove them in there. Just get them out of the packaging. Got a little survival guide that you can download if you want. We'll throw that in the garbage pile. You've got some super skin so that, like you get a cut on your scrape, your knees, whatever. It's just, a nice big Band-Aid. Works really well. Here's another one, just little Band-Aids. Right. And honestly, let's be honest, out of this whole kit, this right here is the module that get used the most besides the little ibuprofen and stuff like that. This is what's going to get used the most. Last but not least, you've got burn dressing. So you got a burn relief dressing, but you also have burn relief gel. Now, let's talk about the gel for a minute. If you have somebody with like a minor burn, I think that might be okay. But if you have somebody with a massive burn, we're talking like life-threatening burn, really deep down burn, I would just soak it with water to put the fire out, and then loose gauze and just put it on loosely, because when they get to the burn ward, if you put gel on that, that's more stuff they've got to take off and it's more painful for the patient. I have treated burns. I did have a person die that was all burned up, 99% burns. We just put them out with water, and then because even though it looks like they're out, they're not. You pour water all over them, and that'll make them feel better too, but they're also going to get hypothermia, right? And then we wrapped it with loose gauze. I think that's the best bet, so be careful with that. Gel, I would not pre-stage this. I would keep it all nice and sealed up. You'll need that because of the burn. All right, that's everything. The MyFAK. So let's talk about it. Would I buy it? Now, full disclosure, they sent this to me because I asked for it. They're not paying me for this. This is not one of those videos where they send you something and they give you money. There are people on YouTube that do receive a product and they do a product review for money, give you an idea of how much that costs. Usually it's like about $2,500 they get to go do that. That is not happening here. I did ask them for it because I wanted to evaluate it, but I gave you the honest truth of everything. The things I like, the things I don't like. Would I spend my own money on it? Yes, I would. Would I spend my church's money on it? Yes, I would. I think it works really well. I think it's a good pre-stage kit that has everything you need. I am telling you the only thing I would do, 100%, get rid of this rat's tourniquet. I know that My Medic is going to watch this. Don't be too mad at me, My Medic. You need to replace this with a catch tourniquet. It is going to be much more tolerable to the patient to use this. And when you look at these two things, so many combat vets out there, so many cops, firefighters, nurses, stop the bleed classes. This is what people were trained on, okay? It's right here. Not a lot of people were trained on this, and this is going to cause a lot of pain. So just my 2 cents. This is out of this entire kit. This is the only thing I'm getting rid of, or the tourniquet. This is the only thing I'm going to replace, besides maybe the wound packing contents, the quick clot, just because I want something a little bit better. Will it still work? Absolutely. I'm not in a rush to replace it like I am the tourniquet. My Medic did a good job with this pack. They did send me one other thing, and I'll evaluate that later and take a look at it for you guys. But if you want this pack, I have an affiliate link. You don't have to use it. I don't care if you do. It just sends a little money to the channel to help upkeep of some stuff. So if you want to use the affiliate link, go ahead. I just hope that you trust me that I'm not going to recommend something that is garbage. So that's all I got for now. Do me a favor, hit subscribe, leave a comment about everything in here. I love reading your guys' comments. It's awesome. The most important thing that you need to do when you leave here is to remember your ABCs. Always be caring.